The federal government has opened applications for its vaccine injury support program. It provides compensation to people who are diagnosed with rare but serious conditions after receiving a COVID vaccine. We've got CBC's Janice McGregor tracking this story live from our nation's capital. Let's begin with those side effects. What are some of the things people have been going through, Janice?
Right, because, millions of us have had vaccines and it has been a perfectly safe experience. But in a small handful of very rare situations, people have been diagnosed with some pretty serious conditions. I'll give you an example. Last night I was speaking to Murray Hellickson. He's from Edson, Alberta. And he's just otherwise healthy 49-year-old, works as a physical laborer at a local lumber mill. But he got his AstraZeneca shot at his local pharmacy. A few weeks later, started feeling tingling in his hands and feet, then started losing strength in his arms and legs. Told me had trouble even kind of palming the steering wheel when he was driving. Eventually, after sort of not getting anywhere at his local hospital, he was sent to neurologists at the University of Alberta Hospital in Edmonton, diagnosed with Guillain-Barré syndrome. This is a rare neurological disorder where your immune system starts attacking your nerves. And eventually, if it wasn't caught, wasn't treated, it could have led to serious paralysis. His doctor believes that this was triggered by his COVID-19 shot. And they reported it to Health Canada. And Health Canada keeps a database, actually, of these rare but adverse events. And there have been 15 people who have been diagnosed with this same condition. Murray would be the 16th. A very scary situation for him and his wife, Jennifer Donovan. Take a listen.
Well, it was bad. I phoned my family members. You're not sure? Because they said it's very serious, and if it starts to affect your lung, or you're talking. So I phoned my family members and kind of went through that whole thing. Yeah, it was as scared as I've been for my life, for sure.
Watching your spouse go from tough guy, go all the time, to not even being able to walk. Everything goes through your mind.
Murray's employer has been very supportive. His wife, Jennifer, there had to kind of back away from her job for a while, serve as his caregiver. But it's interesting, the government's sickness and caregiver benefits for COVID-19, they only apply to you if you're sick with COVID, not if you're sick because of your COVID shot. So they're hoping that he will be eligible now for this new compensation program the government's brought in, but they're anxious because the criteria says you're only eligible if you have a serious and permanent injury, and he's still hoping to recover.
So then let's look at that picture. If you are fortunate enough to recover fully from the side effects, does that mean then you will not qualify for compensation?
Well, this is what's so unclear. They've hooked up online with some other people who are in the same situation, including Matthew Daw. He's from Calgary, engineer, 40 years old, a runner before this, was out running a 5K a few days after his shot, but a couple weeks later was out walking his dog. His feet started to feel numb. A few weeks later, he found himself in hospital, unsure whether the paralysis was going to spread so fast he could, need to be on a ventilator if it spread to his lungs. Very concerning. He, too, working hard at his recovery right now, but he's concerned that the government is trying to limit its liability to only the most catastrophic illnesses and deaths. He says it's not fair. Take a listen.
Letting more people in and then sorting them accordingly, as opposed to being very narrow like they are now, is not good. Everybody's damaged. Everybody who's damaged needs to be heard. They have the right to complain to the government or to say that, hey, you said this was safe. It wasn't safe for me.
Now, the government's contracting the administration of this program, including the adjudication of cases, to a third party. It won't say kind of how much is available to people for different things or even what its total allotment is for this program. But I found in the government spending estimates sent to Parliament for approval this spring that it had set aside $19 million for the first year of operation. The criteria, the adjudication may change as the science evolves on COVID vaccine and the side effects from COVID vaccine. But this system is supposed to be less adversarial than one where you have to go to court to sue for damages. Nevertheless, both of these men say they're going to be working perhaps with lawyers on their applications in case they need to appeal.